Good evening and welcome to one more session. Now, what we have done today is, let's say this is like a series. Every week we meet, and this is how our plan goes. We meet on Wednesday, we meet on Saturday, and we meet on Sunday. On Wednesday, we talked about National Exit Test, right? And we talked about PLAB also. So, this is for India, this is for UK, and today we'll be talking about USMLE, United States Medical Licensing Examination, and in depth. We'll be in fact talking about right from the stage 1 to stage 2 CK and stage 3. Sunday is a special day where we talk with parents. Right. Why parents? Because see, medical profession, it's not tough. It's not only tough, but at the same time, it requires meticulous discipline. So this is like that what exactly is the role of parents of medical student, and this can help a lot in the success of that medical student. So this is what we'll be discussing tomorrow at 11 a.m. right, 11 o'clock in the morning. On Wednesday and Saturday we meet at 8 p.m. right. So hello, I am Dr. Bankim Jani, and I did my MBBS. After that, I did my DMRE and the post graduation in radiology. One question was asked, why do you write? Because see, when we write, there is a method which is called as the super reading. Right? There is a method, it is called as the super reading. This method is in fact extremely helpful to improve your memory and comprehension. Comprehension means what? Comprehension means it is ability to understand the subject and then you represent it in your own language. That is what is called as the comprehension, right? So how wonderful would it be if both these things they can be improved? This is the method, right? That is the super reading. So the base or the crux of this particular method is what's called as the keywords. Keywords in your life, in your education, during any stage, if you have learned how to remember the keywords, you'll be able to explain that particular topic in your own language. You won't have to cram, and at the same time you will remember it for a very long duration. You will remember it. And then there is a method, what is called as the memory activation. This method is so effective based on the principle of what is called as the repeated revision, right? Or also called as the spaced revision. Spaced revision. So you repeat your revisions in a very specific way, in a very specific format with a proper duration, then you'll be able to remember it for a very long duration, right? We'll be coming up with even this concept also, right? You can send a mail and then accordingly we'll plan out for this session. Okay, so apart from medical, I acquired 23 international accreditations in IT. That is from Cisco, Sun Microsystems. These are all international IT companies. Microsoft, you must be knowing definitely, right? Microsoft, Microsoft, and then Novell. There are a few more companies also, but I think this is. I'm into photography. I got the entire Canon gears. You can see my photographs on my channel. Then I am into painting. Even my all 36 oil paintings, they are there, right? And few more things. Okay, one important thing which I usually say at the end, but this is like I am an ultra marathon runner. Ultra marathon runner, that is when the races they are more than 50 kilometers at a stretch, right? Recently we completed 2 races, both of over 60 kilometers, and Sunday, tomorrow, I'll show you picture of my medals, right? There are about 118 medals, pre-COVID, post-COVID combined. Okay. So let's come to our today's topic, and this is USMLE. USMLE. Say, after your MBBS, so this is not the destination. MBBS is not the destination, it's a journey, right? Reach to a level where you can say that, yes, this is good. This is something which you should be proud of. You need to go for post-graduation. Post-graduation, it can be done in India. If you are doing it in India, you'll require that national exit test. Till this point, it was NEET PG. Now it is not needed, right? All these things, they were explained in detail on Wednesday, right? Just before 2-3 days. What we are now doing over here is that, yes, you are MBBS, but you wish that I need to practice in USA or Canada. When you say you want to practice in US or Canada, then they say that, yes, you can, but you have to appear for this particular exam, USMLE. This is a long exam. This is a very long format. So it will take pretty long time to complete it. Reason? That, well, you want to do medical practice, right? You want to do medical practice in USA or Canada. So they have got their own standards. In a way, what really happens, they have split the whole exam into few steps, right? It is the step 1. Then second is step 2, CK. CK stands for clinical knowledge. Previously, there was one more part, that was CS, clinical skills. But now that part has been removed from the step 2. It is merged in step 3, right? It is there, but it is merged in step 3. Step 3 is a completely different game. In nutshell, if I say that these things, these step 1 and steps 2 CK, they can be, one can appear from India, right? In other words, person can appear for these steps even outside the US. But step 3, yes, you need to appear it in US only. For that, you'll be requiring visa. Yes, definitely. You'll be requiring visa, and we'll talk about, right? We'll talk about that visa. There are 3 types of visas which can be applied, and we'll just have a look at it, because this was one of the questions that once you complete your step 2 CK, then you have to appear for step 3 and you have to go to USA. How will you get visa, right? So we'll talk about it today. Okay, so step 1, step 2 CK, and step 3. What exactly, how we shall be proceeding? We shall be proceeding today with few concepts. First, we'll see that how is the exam, right? How is the exam? How many days, how many questions, right? All those things we'll talk about. Second, what if you want to apply? If you want to apply, then first thing which you need to check is your college registered for the WDOMS World Directory of Medical Schools, right? I'll show you how to see that, because from that you will be requiring a number which is called as the FAMER number. That FAMER number is what you have to put it into your ECFMG form, right? So we'll see the entire procedure. And third is what we'll see in depth about, say, advantages, right? How to prepare yourself. Or I would say that we'll also be looking at the finances. How much would it really cost, right? We'll cover that part also. So let's start with first thing. And this is when we say IMG is international medical graduates. Now understand this. Whether you have done MBBS from India or you have done MBBS from anywhere in the world except USA or Canada, right? So it's like MBBS done from India or, say, other countries, except US or Canada. If this is the situation, so then you are called as the international medical graduates, because with perspective of US, right? But that's the thing, with perspective of US. Now, international medical graduates. Graduates means they have passed their MBBS. They passed their MBBS fully, right? The final year cleared. Can only they appear for USMLE? No. Medical student can also appear. Medical student. That's the reason we are over here. In association with Vishwa Medical Admission Point, what we are trying to do is we are preparing you right from the beginning that, see, this is the exam. And friend, if this is the exam, if this is the whole case, this is how the world is going to compete, so why not to prepare yourself right from the beginning so that you get a better success, right? That's the intention. That's the reason we are meeting repeatedly, to guide you and to make you understand that what exactly it is. Medical student, can they appear? Yes, they can appear. For step 1, yes, for step 1. When can they appear? Well, the ideal time should be apply after you complete your second MBBS. Then you appear for first step 1. Why should be so? Well, there are few topics, there are few subjects which are asked, and they are part of our second MBBS course, right? So here it is. This is the exam pattern of step 1. Now see how different this is as compared to any of the exam you must have appeared in your entire medical, in your entire education career, right? When I say you appear for this exam after second MBBS, right? Reason you'll know within few seconds. In step 1, USMLE step 1, you'll be asked questions on anatomy. Well, that is good. That is part of first year MBBS, right? First year. Physiology, again, first year. Biochemistry, no problems, first year. Right? Till this point, though, life is good. Then comes behavioral science, right? Now, this is typical. Behavioral science, this is something which we need to study, you know. Then communication skills, right? Why communication skills? Because you will not be dealing with robots, you'll be living with living human beings. So that's why these two things, they are considered as vital. And on top of it, other things which are asked in step 1, pharmacology, right? Pharmacology, medicines, drugs, right? Pathology, what is wrong with the body? Pathology. Now, these two subjects, they hold almost 45 to 50%. Huge one. And my second year students, they would agree that pharmacology and pathology, that is not that simple. You require good dedication for it, right? That's the reason when the pharmacology and pathology you have completed in your second MBBS, and then you are pretty comfortable with the subject, knock it, right? Go for step 1, right? Because that's the right time to do it. Now, how this exam would be organized? USMLE has got the pattern to take exam in what's called as the blocks. It's a 1-hour block, right? It's a 1-hour block. So in this 1-hour block, one after the another, you'll be asked questions. How many such blocks? There would be 7 1-hour block. So is it a 7-hour exam? Well, the exam is of 8 hours, right? Exam is of 8 hours. 8 hours. 1 hour, that is your break. 1 hour is the break. right? Interesting. So in this 7 1-hour blocks, there would be 60. This is like 60 minutes and 40 questions. 40 questions. This is called as one block. So there are 40 questions asked and 60 minutes, that is 1-hour block, and thus such 7 into 40, such 7 blocks, which comes to 280 questions. 280 questions in total, right? That is what is asked. Now, typically, you need to understand this pattern. Here is the time. Starts now, and for 1 hour, no one would disturb you. You have to complete 40 questions. Okay. This is like block 1 completed. Block 2 starts, right? And again, 40 questions, and you are working. Now, let's say at about 50 minutes, you finish the question. So then these 10 minutes, they are for you. You can relax. If you want, you feel like, let me have 10 more minutes of break. Yeah, you can. And this thing will be deducted from your 1 hour. You can have the total of 1 hour of break, right? Total of 1 hour of break. And if you finish any of the question earlier, that is any of the black block earlier, that's fine. That's you have earned that comfortable time. Okay? So this is still, we have not yet talked about the finance part, right? We are just understanding how the exam is organized. This is step 2 CK. CK stands for simply clinical knowledge. Right? What would be asked? Everything. All systems. I mean, so brutal? Yes, all systems. Simple. Right? You have to go for diagnosis. Yeah. Diagnosis. Also, you have to plan for the initial treatment. What treatment would you give? Initial treatment. And when I say everything would be asked, so that means the case would be given. So in that case, no one knows. It would include anything, right? But it will include all the sign symptoms. It will include the lab test. It will include the radiology test, right? All the radiological procedures. And then you have to come up to a conclusion that what this patient is. And then you have to give the initial treatment also, along with what you will be checked for: legal and ethical issues. Legal and ethical issues. Right? Plus, still there is plus, and that plus is patient safety. That patient safety is considered as on a very high priority, right? So this is how, that's the reason that step 2 CK, you have to plan. You have to plan even for the preparation, right? We are here to guide you for everything, but this is just to know, right? If you want to ask anything else, right, on these numbers, on this number, you can even message or you can talk. Coming back to our subject, step 2 CK, right? How this is organized? Yes, this is also 1 day exam like step 1. But well, it is step 2 now. So let's make it slightly difficult. This is a 9-hour exam. 9-hour exam, right? 9 hours, no mercy, just 1 hour break like that. Right? 1 hour break. So it means there would be 8 blocks. Yes, exactly. There would be 8 blocks, each block of 60 minutes. Yes, right. And then how many questions? Same, 40 questions. 40 questions per block, right? So it will come to what? 320 questions almost, right? They asked 318. 318 questions are in all. So maybe 2 blocks, they might be having 39 questions, or 1 block might be having 38 questions, but total 318 questions, right? Will there be MCQs? Yes, every time I say yes, there would be MCQs, multiple choice questions, in which you have to just click on the correct answer. Everything fine, but I'm telling you, these are not single line questions, right? These are not single line questions. So there might be a descriptive case given to you. You click on next tab, and in that lab tests are given, then radiology images are there, and then you have to come up to a conclusion, right? So this is where you have to apply yourself. That's the reason that these exams, they are considered as competitive exams. Means what? It is like if someone has crammed anything, it's of no use. They really want to see your understanding, whether you have understood the subject properly or not. And that's the reason this is the foundation, what is called as the foundation. If foundation is strong, no worries. You'll be able to learn and excel in any of the field, right? Step three is to be given in USA only. Only. It cannot be given anywhere in the world. It has to be, you need to be physically present into the into the US for step 3 USMLE. Why so? Because what they really want to see is that how ready you are, your readiness, that are you sharp and fast and powerful enough for, I'll write it in capital, unsupervised practice, medical practice, but unsupervised. You know, after you complete your MBBS, you have to go for internship. So when we used to go to internship, and let's say my internship was in a village called Bagodra. Now this was like when you reach over there, you are treated like a god. But then you are the only person over there as a doctor, and you have to handle everything. This situation. These situations are like when they really teach you. This is what is called as the unsupervised practice. No one is going to watch you. No one is going to support you, help you. Do it by yourself. That's what they really want. That how powerful are you, right? It is divided into two parts. Right? This also. Here, there are 6 blocks. Right? There are 6 blocks. Same style, 60 minutes block. Right? So every block, when we say, so it is of 60 minutes. Right? How many questions? 6 blocks. So usually they have got a habit of 40 questions per block. Yeah, true. And again, 6 4s are 240, but over here 232. So few of the blocks they might be having less questions, but usually it is 38 to 40 questions per block. That much is there. And this is day 1. This is day 1. Now see, step 1 and step 2 CK, they were 1 day exam. This is a 2 day exam. So 1 day you have been tested on the concepts, 60 minutes block, 38 to 40 questions. Done. Day 1 complete. Moving on to day 2. In day 2, this is a computer based, right? It's a computer based case scenario. Now this one is where you need to diagnose, and then you have to go for full-fledged management. Everything is asked. How this exam is organized? Well, you are given time, right? 9 hours. 9 hours, right? Full day. There would be 30 questions per block. Bus, 30 questions? Yes, 30 questions. But then 6 blocks are there. Okay, then also it is okay. But one important thing, time is now 45 minutes. This is less. That's right. You have got 6 blocks of 45 minutes in which you have to answer 30 questions per block. That comes to simple mathematics. It is 180 questions would be asked full. And game is not yet over. Once you finish this, plus, right, there would be one more exam in which you'll be asked 13 cases. 10 to roughly 20 minutes per case. This is the reason that you need to understand the subject very, very properly, right? Otherwise, there is no fun, seriously, right? This is that good exam. So that's the whole idea. This is how things they really go. Now let's talk something more positive. You have cleared your USMLE, right? You have cleared it. So then where will you be allowed to practice? You will say, yes, obviously you said US and Canada, no doubt about it. Everything is fine, but you have got still few options. You can practice in the land of kangaroos, Australia, right? UK, United Arab Emirates. You can practice in Dubai, right? Dubai. Now it is called as the DHC, right? Dubai Healthcare City. Then you can practice in Israel, right? Ireland, neighbor of Australia, New Zealand, right? Qatar, and in capitals, India. Yes, you finish your USMLE, and then if you feel like I want to practice in India, you can. You don't have to appear for next, right? National exit test or any other test. You don't have to appear. You just practice in India. So that was good, right? Let's apply. How will you apply? There is one step which is so crucial, which you have to finish even before you apply for the real test. Right? This entire game, ECFMG, right? I would say it is like a game, right? It is like a season. The whole thing is planned by Education Commission of Foreign Medical Graduates, right? Foreign medical graduates. So ECFMG takes care of this part. Now, chalo, you want to apply for it, right? So if you are in USA or Canada, so in that case, it is the National Board of Medical Exams. NBME will take care of you. Right? And the advantage is that if you are into US or Canada, there won't be any surcharge, no surcharge. Now, what this no surcharge means? What? No surcharge means that if you are appearing from outside India, outside USA, right? Let's say from India. So then because the exam is getting conducted outside USA, you have to pay extra. You have to pay extra for your exam, right? So that's why the step which we are about to watch is only for rest of the world. This is only for that. They have to apply at the portal of ECFMG, Education Commission of Foreign Medical Graduates. Right? So in ECFMG, what you have to do? There is a form. It is called as the Form 186. I'm giving you the numbers also so that if in case anyone wants to apply, the path is clear, right? There shouldn't be any mistake. And on this form, so it in big bold letters on the top, it is written this Form 186, right? Something which you just can't miss. Otherwise, rest of the forms, right? They are for various purposes, and we'll see that. ठीक है, Form 186. What is that? This is certificate, right? See, this is certificate of identification. Certificate of identification. You should be identified that it is you only. So for that, you are given a number, right? You'll be given a number, and this number would be permanent. This number would be permanent. That's how it goes. How to do? You have to apply for it. Apply, right? Where to apply? It is ECFMG dot org. Exact over here, right? You have to fill this form and you have to submit. You have to submit this form at ecfmg.org, right? It comes at a cost $160, right? But in this there is nothing like pass fail, right? Nothing. So chill. But this number is needed, right? It will take about 2 to 3 weeks, right? Within 2 to 3 weeks you get the number, and this would be your ID. That is your identification number, which will be same for rest of your life, right? So this is one. To apply, right? All questions we are taking. To apply, is there any age limit? Is there any age limit? No. There is no age limit. There is only one criteria, that you should be officially enrolled. When you say officially enrolled, means you are a student, correct? You are a student. Or when it is said that you are this officially graduated, that means they are doctors. They have already completed their MBBS. Yes, they can be part of this USMLE. So far, so good. But here it is that it is said officially. Yes, officially. Officially enrolled or graduated. But from where? They'll say obviously the medical school. But ECFMG would say ki, I want that is your college appearing in World Directory of Medical Science. It is called as the WDOMS. WDOMS.org. Does it appear? If it appears, great. You will be getting a number which is called as the FAMER School ID. It is a number. It is like the complete ID of that particular college, right, or school. So this is the school ID of that particular college for which you have applied. It should appear, it must appear, right? It must appear into wdoms.org. Otherwise, trouble. Seriously, it's a trouble, right? So don't wait that if the false commitments are given that yes, college will be enrolled after 6 months or 1 year, who knows, right? Just check it, wdoms.org. Is it appearing over there? Yes, good, right? Otherwise, it is all marketing thing. So over here, this wdoms, want to see? Wait, right? We'll just have a look. It is wdoms.org. Here it is. wdoms.org, World Directory of Medical Schools, and search the World Directory right over here. Search. A dialog box opens, right? And we just give the details. Let's say India, right? India. Okay. Then you know the name of the school, you can type straight away. Or let's say city, Ahmedabad. Operational or not? Well, this is yes, but even if it is non-operational, right? But if obviously it was operational when you passed, so right now it tells the what's the current status. But you can search even with this much, and you click, and here is a list: BJ Medical College, right? And then rest of the medical college. But here is my medical college. Yes, it is there. I just click on it. And this number, this is my FAMR number, right? So easy. No registration, nothing, right? No password, straight away wdoms.org. Give your college, search for the college, give your college and see whether the FAMR number is there or not. It has to be there. Otherwise, say if the college is not over here, right? In medical, days are long but years are short. You won't even know when the 2 years are completed. And then when you wish, ki chalo, let's appear for step 1. And then if the college is not enrolled or it is not part of WDOMS, right, it would be a very severe break, a very harsh break on your career, right? So that's why giving you this warning right from the beginning. Watch for this wdoms.org and then take this FAMR number, because without this FAMR number, nothing can be done. Nothing can be done. This FAMR number is to be filled in one of the column of this ECFMG form, right? ECFMG form. Over here, as I said, that see, this is your ID, right? This is your ID. This is your permanent ID. This, so you can take even the moment you take the admission, you can take this ID, because this ID, your ID and this FAMR number, they will be needed for applying for the exams, right? So here it is, how will you apply, right? This is the step 1. Step 1. So how you'll schedule your exam, right? Exam fees, $985 US. This is examination fees. And we feel almost ₹1,00,000. Right? Then still it's not over. You know, I said that there would be surcharge. Yes, that's the surcharge. Surcharge. How much surcharge they apply? They put. It is called as the international test delivery surcharge. Test delivery surcharge, right? And that is $185. But it is for everyone. Everyone has to pay, right? So the total is about $1,170. That's the expense for step 1. Step 1. You have planned, because this is like you can schedule the exam. You feel like, chalo, I want to give exam on 25th. No problem. You book the exam and on 25th you go and you appear for the exam. But in case by the time you reach to this date, right, if the anxiety keeps on increasing and you feel like, nahi, abhi nahi deni, I want to reschedule the exam, right? Reschedule. And when you reschedule, again it will come at a cost, right? $604 additional is what you pay. You feel like, I still want to say extend it. No, right? This is the limit. This is the limit. The validity of this exam, right? Validity once you pass. Say it is straight away, if you pass this step 1, right? You appear for step 2. You appear for step 2. You have got sufficient time. It is like 7 years. Within 7 years, you have to complete. So this is valid. Right? You have got 7 years. Right? We come to this point in more detail. Before July 2021, right? Almost 2 years back. 2 years back. 6 attempts were permitted 6 attempts. Okay. But now, after this July 2021, now 4 attempts are allowed. 4 attempts per step. Well, that is something, right? 4 attempts per step. But there is one interesting rule which you have to follow. One goes for attempts, right? First attempt, second attempt, third attempt, and then he tells I want to go for fourth. No, he won't be allowed. 3 attempts in 12 months. In a year, if someone has finished 3 attempts, so then he would say, gentlemen, whatever it is, now there has to be a gap of 12 months, 1 year, and then you prepare yourself and then appear. This is the 4th attempt. That is the 4th attempt. It is only after the gap of last attempt and then 1 year, right? So this is like, because this is the last chance. So ECFMG is telling you that you prepare yourself and then appear for it, right? We take it positively. Now, if pass, these exams, right, are the scores important? Yes, very. Because in step 3, you have to go for your further studies to US. And that is where, in which university you are getting. So that depends upon the score. So someone feels कि chalo, I'm ready to go for again, retake. Not allowed. Not allowed. You can't take retake. If pass, so that means pass, whatever the score, it is full, final, that's it, done. Results, they come pretty fast, within 2 to 3 weeks. So pretty fast results there. Right? So that way, you have applied, and one after another, you are clearing the exams. Exam cleared, scores arrive, and scores, they are displayed on, right, displayed online, and they come within 2 to 3 weeks. Okay. That score will remain over there for 1 year onto their website. What after that? Well, it won't appear over there. So can we fax them? No, they won't reply. Can we email them? No, they won't reply. Can we call them? No, they won't reply. Simply, you need to go for what's called as the transcript. Transcript is that piece of paper in which every detail is given. How many attempts, which year, right? Your score, everything is given. So that is what is called as the transcript, and that comes also at the cost of $70, 70. Right? Now there are 2 types of transcript. So don't make a mistake. One is you want the transcript at an individual level. Individual. You yourself want that, okay, as if we get our mark sheets, right? So you say that I want my individual, it's my individual requirement. So then you will fill up form number 172. In both the cases, you have to pay, right, separately, but purpose is totally different. Now you have applied for step 3 at some college or institution in US. So this is institutional. This is institutional. Why they need? They want to check their candidate, that is he a genuinely passed USMLE guy or not, right? So that's why it is institutionally checked, and this form is called as the form 173. Right? That's it. So if you want your score sheet, so then you have to go for this. What if someone is not successful in passing this exam, fumbles? So then will you go for score recheck? Okay, chalo, let's check it again. Right? You can do that. You have to apply for that within 90 days, right? Within the 90 days, you have to apply. This is what is called as the form 265, right? Will cost you $80. Right? Expensive. But well, want to go for score recheck. This score rechecking is not done manually, right? So this is not normal manual process. It's totally digital. Till date, no one has got any of the update in the scores, right? Results unchanged. Results unchanged. Right? So better not to apply for it. Seriously, practically, I'm telling you, don't apply in case if it happens. So we talked about step 1, we talked about step 2, we talked about that how to apply, right? Step 1 and step 2, they are the same charges. Same charges, right? What we discussed, 985, right? Exam fee 985. Then there was another that was that surcharge 185. This was 1170. For verification, right? For verification, well, it is needed if it is needed by any of the state, right? State medical licensing authority, right? State medical licensing authority. For verification, $66, right? When it is checked by anyone else, any university. Okay, now comes the step 3. This one is step 3. Now in step 3, one has to appear only in USA. Only in USA. So you'll require visa definitely, otherwise who will allow? Options, there are a few options where you apply as a student visa, which is not bad, not bad. Then there is another category, right? It is like theoretically it is mentioned, and that is exchange of visitor visa. Practically, right? Let's not consider. And then this is H1B, the most powerful, but this is like work visa. So once you take that admission, right? Once you reach over there, then depending upon the visa, say you can work. The idea is to clear step 3. Idea is to clear step 3. And as we discussed, step 3 is a combination. It's a 2-day exam. And a 2-day exam, and that exam is where cases also will be asked, questions will also be asked, everything, right? Where you have to go for, you have to emphasize on diagnosis and the treatment, both the things. In 2022, right, rates were slightly less. It was like $895 of exam, 895, right? But in 2023, right, effect came, and it has now become, they said that this is just too less. Well, the difference of $20, right? That is extra. That is what you have to pay for step 3, examination charge. One has got, we talked about it, 7 years to complete this entire course, right? Complete USMLE. They got 7 years, right? Pretty long time. So that is how You go for step 1, step 2, step 3, but remember the keywords. USMLE is for Australia and Canada, right? And when it is said the transcript, so transcript is that piece of paper, right, which shows all the attempts, scores, that is what is mentioned, right? So this is how it really goes. The way in case of PLAB, one has to appear for IELTS, right? No IELTS, no TOEFL, no. None of these exams, they are needed when one goes for PLAB or when one goes for this IELTS and TOEFL, they are needed when one goes for PLAB. But for USA, and that is for USMLE, right, they are not needed. Right, for USMLE, they are not needed. Simple as that. Email was there that what is the success ratio? Well, I would say never compare. Right, success ratio of such exams, they are usually less because they ask such questions. So that's the reason one has to prepare very meticulously with very proper discipline, and thousands and thousands of students, they have cleared this exam. So don't worry about it. Last time one question was also asked, right, in the mail, that what if my college is not shown in wdoms.org? If it is not shown, then gentlemen, it is a most unfortunate thing, because without this, say you cleared your second MBBS, but you won't be able to appear for step 1. No. Right? So that's why be careful right from the beginning. One more question was there, right? How many hours one should study? Well, I would say quality, right? Quality matters over quantity. I tell my students that if you really want to pass USMLE, plan. Plan means I'll never say that you plan like that, I'll study for 4 hours and 6 hours, nothing. These are the 5 topics. Complete those 5 topics before you sleep, right? Before sleep. But this is the planning which is needed. This is the planning. If you plan as per the content and not per the time, you'll surely be successful, right? So this is the entire game of USMLE, right? You can send the queries over here, the number which is given over there, right? So thanks a lot. Thank you so much. And we are definitely meeting tomorrow morning at 11. All right. Thank you and bye-bye.